Struggling with knee pain and wondering whether or not stretching is the solution? In this video, we'll get into whether or not stretching a hurting knee can help or hurt you. Trust me, your knees will thank you. Got a problem with your knee? This is Dr. P, otherwise known as Dr. Mark Petropoli. Today we're going to look at another mailbag. I know a lot of people send in comments and we greatly appreciate that. Another question was, what are the common knee conditions that stretching and exercise can help? Anterior knee pain, pain in the front of the knee, okay, where the kneecap is. So patellofemoral pain syndrome is just a fancy name. Patella is the kneecap, the femur is the thigh bone, patellofemoral is where the kneecap and the thigh bone basically articulate and rub against each other. That area of the knee can have pain for many reasons. It can be the actual kneecap cartilage is starting to wear down. It's getting soft. We call that chondromalacia of the patella. It can also be where the patellar tendon, the kneecap tendon, it has some tendonitis, or even the quadriceps tendon, which is above the kneecap, can have some tendonitis. So that's it, commonly runner's knee or jumper's knee. You might hear about that. So that's inflammation of the tendons around the knee. You could have inflammation of where the kneecap articulates with the thigh bone. So if your tissues are tight, the pressure, the contact pressure where that kneecap is rubbing is going to be more. And so the more pressure, the more pain there can be. So stretching does usually help that. There are certain ways to do stretches, which we're going to demonstrate in some videos. At the end of this video, I'll have my expert staff over in the rehab department demonstrate some simple stretches. There's a lot of different stretches that can be done, but we'll demonstrate a few. And the bottom line is that stretching for pain in the front of the knee, to loosen up where that kneecap is, to loosen up those tight tendons, can definitely help. Another thing that we see is people will oftentimes have a degenerative meniscus tear. Okay, well, what's the difference between a degenerative meniscus tear and a regular meniscus tear? Well, first of all, what's a meniscus? The meniscus is the little shock absorber cartilage in between the ends of the thigh bone and the shin bone. So you have your thigh bone, your shin bone. In between are two little shock absorber cartilages called the meniscus. They help to absorb force, but they also provide stability to the knee. Arthritis is the cartilage on the end of the bone. It's a different type of cartilage. The cartilage looks kind of like the white on the end of a chicken bone. When that wears down, that's what arthritis is, kind of like the tread wearing down. So just like the tread can wear down, the shock absorbers, the meniscus can wear down. So that's more of a degenerative meniscus tearing. It's not like a piece is flopping around. It's not like an 18-year-old soccer player twisted their knee, felt a pop, and now they're getting locking in their knee. So it's more of a degenerative wear and tear condition. Well, if the thigh bone and the shin bone are too tight, the pressure, the contact pressure is too tight because the muscles on either side of it are too tight, the tendons are too tight, they're not stretched out, then that increased contact pressure can cause pain. Remember, underneath the cartilage is bone, and bone has millions of pressure-sensitive nerve fibers, so that's why people get pain. Tendons have nerve fibers in it, that can hurt. So yes, there are certain stretches that can actually even help with quote-unquote meniscus tears. But you also have your degenerative arthritis, where the cartilage on the end of the bone wears down. Same thing. If that's wearing down, the tread's wearing down, just like the shock absorbers, if those are wearing down, if there's too much pressure, again, more pressure is going to get transmitted to the bone underneath. Bone has millions of pressure-sensitive nerve fibers, and it's going to hurt. So stretching can help loosen up and mobilize and allow for more mobility, better, more fluid motion. You don't want jerky motion, cogwheel motion. You want nice, smooth motion, and that will allow the joint to work better and have less pain. And another way to think about this is look at some of these quarterbacks. I mean, if it's football season, look at some of these quarterbacks. I know Tom Brady's retired, but he played into his 40s. You got guys playing into their late 30s and 40s at a very, very high level. Look at Aaron Rodgers, how quickly he's recovering. Of course, he probably could have been stretching his Achilles a little bit more. But the bottom line is Tom Brady openly has said multiple times it was more the mobility, the stretching, the yoga, those types of exercises. I mean, a lot of teams nowadays will have a yoga day. I know yoga is way more than just stretching, but staying mobile, staying loose. If you have too tight of muscles and tendons, it's going to put more pressure on your joints. If you have questions or comments or want to know about more specific stretches, put them in the comments. If you like this video, like it. And if you have any questions, always feel free to call. And remember, this is Dr. P. If you got pain in your knee, call Dr. P.